Hi, my name is Casey. I'm a physical therapist at our East Norristown location, and today I wanted to talk about strokes and how physical therapy can help with recovery after a stroke. So every stroke is a little bit different. Every brain is a little bit different. What is affected by the stroke depends on where in the brain it is. It could be a matter of the stroke affecting an entire side of the body. It could be a singular limb. It could be something completely different. But at the end of the day, it likely impacts your balance, the way that you walk. Maybe you're walking with a cane or a walker now. Maybe you're a little off balance. Maybe you're falling a little bit more at home, having trouble getting up from a chair. Those things are absolutely things that physical therapy can help with after a stroke. What we'll do in physical therapy to address your symptoms post-stroke greatly depends on what symptoms you come in with it, what things we want to work on to get better at home or in day-to-day life. So it'll be very different based on each person. And then the potential for improvement is different for each person as well, but typically in that first year is when we see the most amount of improvement that we're going to see after a stroke. But the sooner we can see you once you're home and medically stable, the sooner we can see you in physical therapy in an outpatient environment, the more likely that we're going to be able to recover more function. Strokes can also affect things such as memory, cognition, speech. These kinds of symptoms are something that is more appropriately treated by a speech language pathologist, a speech therapist. And as we kind of talked about before, a stroke can affect arms as well as legs, and some kind of more fine motor function in the hand. If that's what you're looking to address, that might be more appropriately addressed by an occupational therapist or a certified hand therapist. Might have a little bit more knowledge about that specifically, but especially if you are worried about the way that you walk, if you have trouble getting up out of a chair, turning over in bed, then those are all things that physical therapy can absolutely address. And that is not all encompassing, because there are many deficits that you can be left with after a stroke, but physical therapy can help to recover some of that function that you may have lost short-term post-stroke.